Previously, we've talked about how the body is affected during a COVID-19 infection. But not everyone who gets sick recovers quickly or completely. This week, we are going to be talking about COVID long haulers. What does it mean to be a long hauler? Long haulers are individuals who are experiencing long-term effects after a COVID infection. They've had COVID and they no longer have an active infection, but they haven't fully recovered from their symptoms. This condition is also known as continued COVID, long COVID, post-COVID, or post-acute COVID syndrome. While some people recover completely, others continue to experience symptoms for weeks or even months at times. Even people who have a milder version of the disease have continued to show symptoms in some cases. A Lancet study reported that 76% of individuals still had at least one symptom 6 months after recovering from COVID-19. Another University of Washington study, with participants who'd had mild COVID-19, were followed for 9 months, and 30% reported persistent symptoms. Some of the most common symptoms in long haulers include shortness of breath, loss of taste and smell, fatigue and lethargy, cough, and chest pain. Organs other than the lungs, including the heart, kidneys, and nervous system, can also be affected by COVID-19. When these symptoms are affected, people can experience rapid heartbeat, joint and muscle pain, headaches, depression, trouble sleeping, and difficulty thinking or focusing, also called brain fog. Many people have more than one symptom, and symptoms can come and go. It's difficult to predict who might experience these long-term symptoms. Long-haul COVID has been observed across people of all age groups and regardless of pre-existing conditions. We don't fully understand what causes some people's COVID symptoms to persist. Some complications could be caused by extended periods in intensive care, which can be rough on the body, especially if patients were intubated or on ventilators. But even patients with mild initial cases of COVID can become long haulers. Other symptoms might result from damaged capillaries or inflammation resulting from a triggered autoimmune response, or even direct tissue damage from the viral infection. So how do we treat long-haul COVID? It depends on the symptoms someone is experiencing. One consistent treatment is supportive care, which emphasizes the need to slow down and make time for the body to recover, including through sleep and gentle exercise. Depending on a person's specific symptoms, they might also be prescribed anti-inflammatories, antidepressants, or other medications. Some people may need rehab or physical therapy. Patients with poorly understood conditions, like long-haul COVID, sometimes struggle to get others to take their symptoms seriously. Early in the pandemic, people started reporting lingering symptoms after recovering from acute COVID, but not much was known. Some of these patients formed focus and support groups to advocate for their needs and make their experiences more widely known. With time and with the help of long haulers who are willing to speak out about their experiences, we are gaining a better understanding of long-haul COVID. If you're experiencing long-term effects after COVID, know that you're not alone. We'll include some links to patient groups in the episode description if you want to learn more or connect with other long haulers. There's a lot we still don't know about long-haul COVID, but as time passes, we understand more and more. Hopefully, the research underway now will help doctors understand how to better support long haulers so that they can recover and thrive.